Well, when it comes to New Year's resolutions and goals for the new year, we have discussed finances, we've discussed mental well-being, but let's discuss the physical. When it comes to our health, we have to be realistic. Many of us start off really strong in January, join a gym, start eating healthy, but by the time it's been a few months, we fail. So how do we maintain the good habits? To talk to us about that, we have our guest, Dr. Tamara Aldawery. Thank you so much for being with us on the show.
Thank you. Thank you for having me so much.
So what do you think the big mistake is? Because yeah, we're all like, January, I'm eating right, I'm gymming 5 times a week. What's the mistake that makes us give up after a couple of months?
I think the most important thing, and what's already been touched upon, is actually understanding why you want to make the change. So the most important thing to realize, for me, I've come to this realization recently, is that actually the reason why you want to change is to get the most out of your body. We only have one body, and if you abuse it, you're not going to get the best out of it. So really, it's just about thinking about, what do you want? Do you want quality of life? Do you want to fit into your summer body physique? Is there something specific that you're looking for? And that will motivate you throughout.
It has really changed my mindset when it comes to the gym, when I went from I want to go to the gym to look good versus I want my body to function properly.
Yeah.
Do you have any advice on how to switch that mindset?
Yeah, I think for me, I think when you hit your 30s,
yeah,
that's when it's like, okay, actually, it doesn't matter what I look like anymore. Actually, I want to be able to get up off the floor without everything clicking, you know? Simple things like that. So
without making this noise.
Yeah. So I think the most important thing is actually just surrounding, for me at least, my social media, majority of it, the people I follow, is motivational content, lifestyle advice, that kind of thing. So everything you consume should be aiming you towards a better version of you.
And it's so interesting that you touched on that, because equally it works the other way. You know, friends of mine are following these incredible yogis with this physique and they've just had a baby. And she's like, but I want it to inspire me. And I said, yes, but that's perhaps one step too far, because she was getting quite depressed over watching it.
Yeah.
So with that in mind then, what advice would you give to people that say, because it's such a common goal for 2025, it's not about a diet, is it? It's about a lifestyle. What advice would you give if they are looking to change that for next year?
Yeah, I think the most important thing to look at is actually what you're putting into your body and what you're getting out of it. So what I think about when I'm looking at someone as a patient is, what are you eating? What supplements are you using? Are you overusing supplements? Are you just going to the pharmacy and I want creatine, I want vitamin D, and blindly taking stuff that you don't need? And then also your mental state. So have you actually looked at, your anxiety? Is that affecting the way that you eat, the way that you interact with your peers? And then the out is weight training, for example. So weight training, Pilates is my gold standard advice that I give to everyone. If you're going to consider doing something, that is probably the best thing that you can do. But lesser than that is just walking every day for 30 minutes.
Right.
It's something that you can habit stack. We already walk around to go to the shops. Why not just extend that walk to get the most out of your day?
Well, Dina actually posted a really good reel recently, because we're not that kind of city, right?
Oh yeah, where we want to do 10,000 steps a day, but then we come to the mall and we spend 30 minutes trying to find a parking spot right next to the entrance. Thanks for finding that funny.
Yeah.
Oh, bless you. Yeah, no, I think you just have to work around what's realistic for you. There's no point in setting an expectation on yourself that you're not going to be able to commit to. If you're thinking in January you're going to do 5 times a week strength training, but actually you have a 9-to-5 job and a 2-year-old, that's not realistic. So you need to try and figure out what can better your health, but what's within your realistic limits. And a lot of times in clinic, what I try and do, if there's a specific worry or concern that you have within your health, we try and look at the whole picture. My specialty is family medicine, so we look at all of you, not just the physical, the mental as well is important to look at.
It's fascinating.
And what do you think about the psychology of dieting and how damaging it can be?
I actually don't recommend specific diets. So for me, what I try and explain to people is intuitive eating is the most important thing. So when you're eating, try and be aware of what you're eating. I went through a phase, I lost 30 kg. Okay. I would just be blindly eating without realizing what I'm consuming. So I wouldn't even be enjoying the meal. I would just be, putting in food blindly. So first thing is looking at what you're eating. Are you enjoying what you're eating? Are you present while you're eating? And then the second thing is looking at the quality of food. So a Mediterranean diet, a Greek diet is actually the best. So I like to try and imagine I'm in Mykonos.
Yeah.
Grilled fish,
That
grilled
might not
veg.
be the best.
No.
Olive oil.
Olive oil,
Plenty of
exactly.
olive oil.
Drowning in olive oil. So yeah, I don't like to recommend specific diets without the guidance of a dietitian. My job is just to try and promote a general overhaul of the way that you think about food.
Yeah, because it is your relationship with food and
Yeah.
how you view yourself when in terms of food. I actually want to know, Marissa, a little bit more about the psychology aspect and why people mistreat food either by not eating enough of it or eating too much of it.
Well, you know, it's a primal, isn't it? When you're a baby and you're unhappy, your mum gives you that milky, creamy stuff. And as an adult, your brain always goes back to what something means. So you go, oh, I'm having a bad day, that ice cream, that pizza, that donut. No one says I'm having a bad day, I need a bit of wilted cabbage. I really need some trout, I need some celery. So the brain is going back to what something means, which is why we love milky, fatty, sweet, sugary, pappy stuff. But we can change our brain and go, no, that's for a baby. That worked when I was 2. When I fell off the swing when I was 2, ice cream, but if my partner left when I was 42, the ice cream wouldn't help. So you have a brilliant brain, and we're so busy talking ourselves into it. Oh, I need it. You've got to talk yourself out of it. No, that worked when I was 4. I'm not 4. It's not going to make any difference to my challenges. I need to eat something better. So use your brain to rationalize why you're doing it, and then talk yourself out of it instead of into it. It's the same. Talk yourself into it or out of it.
Yeah.
So, Dr. Tamara, I want to talk about yearly health checks, because I know we tend to focus on one thing that maybe is plaguing us, and we have genetic. For me, I'm always so focused on breast cancer.
Yeah.
But what should we be checking every year? What are some of the common mistakes that people are making, kind of overseeing?
Yeah, so I think once a year you should definitely check in with the doctor to see if there's any concerns that you have. Specifically, like you mentioned, your worries about breast cancer. So that would be more tailored to your concerns to work out why you're more worried about it. Is there a genetic family history that we need to screen for? In general, yearly health checks are offered via insurances, and you can get any blood test really, but what I like to try and check once a year is vitamin D, iron levels, your B12, your thyroid, and your full blood count to make sure that everything is in tip-top shape, that you don't need any extra supplementation. And actually, it's important to see a doctor, because blindly doing blood tests doesn't give you necessarily answers to how healthy you are. We're not robots. We're not meant to have a certain number of X, Y, Z. We're actually dynamic human beings. Things fluctuate. So it's really important to see someone to work out what it is that you're concerned about, so that we can assess and refer you on if needed.
Absolutely. I mean, we see a lot of things on social media about you should go do this, you should get some kind of enema, you should put this thing on your foot, it takes out the toxins.
Oh no.
What would you say to stay away from?
No, so all of these fads like colonic hydro cleansers and you know, there's another craze going around about cortisol and hormone testing. My special interest is in menopause. The most important thing to realize is that actually our bodies are really smart. When there's something wrong with them, it will tell us. So be more in tune with your body. And if there's nothing wrong, if you don't have any symptoms of anything, it's best not to go looking for problems. If you're worried about something, just see a doctor. So our job is basically to take over all your worries and work out what we can do and how we can fix the situation if there's a problem.
So she's saying, Faris, don't Google it.
Don't Google it.
I don't.
And get off TikTok.
Yeah.
That is the real thing. Get off TikTok, people. Do not get advice from people who are not doctors.
Dr. Tamara, it's been amazing.
Yes, thank you so much for coming on the show.
you.
Now stay right there for just a moment, because Katie, I think we're going to shine the spotlight on our guest co-host today.
We want to get to know Marissa a little bit better. Marissa, you've got 60 seconds. I'm going to ask you quick fire questions, quick as possible.
Okay.
And we'll start the clock in 3, 2, 1 now. What is your favorite New Year's Eve celebration of all time?
When I went to my daughter's house and she and her new husband cooked me dinner, it was my favourite New Year
Oh,
ever.
I love
It was
that.
lovely.
Do we dare ask you about your worst New Year's Eve?
Worst New Year's Eve, I went to someone's house and she said, everyone leave, I've had enough. And I was driving on the freeway home when all the celebrations went off.
Oh,
and it was
no.
Oh,
my
goodness.
worst New
Sounds
Year.
like me. What's the best advice you would give to anybody looking to move to Dubai?
Come, it's a great place.
Right?
I love it.
Perfect. Any movies or TV shows that you've watched recently that we should be...
Yeah, I just watched After the Party. It was an amazing, really gripping TV series. Loved it.
Okay, love that. Is there a celebrity that you would love to do an RTT session on or with?
Ooh, who would that be? Oprah Winfrey.
Oh, lovely. Favourite festive movie?
Oh, definitely Bad Santa. I watch that every year. And Elf. Every year I watch both of them.
Do you have a country or a city for your bucket list for next year?
Yes, Botswana.
Oh, lovely. And final question, time is up. Why Dubai?
Well, it's a very welcoming place. I think it's the most exciting city in the world. I mean, I lived in LA, I lived in London, but Dubai has everything they have to offer, but more. It's safe, I love that. I love the fact it's full of expats, so it's a world full of, I mean, we get so many invitations every weekend to barbecues, brunches, lunches. I've never had such a wild social life since I moved here. But the people, I think I would say it's the people, they're very welcoming, so the people first, that's what I love the most.
Well, Marissa, it's been amazing having you on. It's a true pleasure to hear you speak.
Thank you.
Thank you so much for being on DXB today. And Dr. Tamara, we hope to see you again
Thank you so
well.
much.
You've been fantastic.
Thank you so much.
But for now, don't you go anywhere because you haven't heard Heidi Brown's music yet, and you'll want to. It's happening right after this.